Autism Level 3, NDIS, Quick Answers. Autism Level 3 may support an NDIS application, but eligibility and funding depend on the participant's individual functional needs. Access is not automatic. An access request and supporting evidence are required. Funding amounts are individualized. Reports may include diagnosis, FCA, and allied health evidence. Supports may cover therapy, daily living, and community access. 24-hour support, or SIL, may be considered when evidence shows substantial needs. What does Autism Level 3 mean? Autism Level 3 generally describes a person who requires very substantial support in everyday life. Communication may involve speech, gestures, pictures, or AAC. Personal care may require prompting or hands-on assistance. Safety awareness may be limited in home or community settings. Changes to routine can cause significant distress. Support needs differ between people and environments. The diagnosis alone does not fully explain functional capacity. Does Autism Level 3 qualify for the NDIS? Autism Level 3 may support an NDIS application, but it does not create automatic eligibility. The applicant must meet age and residency requirements. Autism-related impairments must be permanent. Functional capacity must be substantially reduced. Evidence should show impacts on daily activities. The NDIA considers social and economic participation. Strong applications connect diagnosis with clear examples of support, supervision, and risk. Who can apply for Autism Level 3 NDIS funding? A person with Autism Level 3 or an authorized representative may begin the NDIS application process. Applicants must generally be younger than 65. They must live in Australia and meet residency rules. A parent or guardian may apply for a child. An authorized representative may support an adult. Families may receive help from an NDIS partner. Meeting access requirements does not guarantee every requested support. How to apply for NDIS funding for Autism Level 3. Applying for Autism Level 3 NDIS funding involves showing both the diagnosis and its everyday functional impact. Check the age, residency, and disability requirements. Begin an NDIS access request. Submit a current autism diagnostic report. Add functional and allied health evidence. Explain daily support, supervision, and safety needs. Respond promptly to requests for more information. Prepare for planning once access is approved. Autism Level 3. Access request. A strong access request should describe what support the person needs during an ordinary day. Explain activities they cannot complete independently. State whether prompting, supervision, or physical help is required. Describe how often assistance is needed. Include daytime and overnight support needs. Explain risks when support is unavailable. Show how autism affects home, school, work, and community participation. Use specific examples rather than broad statements. Evidence for an Autism Level 3 NDIS application. Clear and consistent evidence helps the NDIA understand the participant's permanent disability-related support needs. Autism Diagnostic Report, confirming diagnosis and history. Functional Capacity Assessment, describing everyday abilities. Occupational Therapy Report for self-care and sensory needs. Speech Pathology Report for communication or AAC. Psychology or behaviour support reports. School, workplace, or support worker information. Carer statements and daily support records. Why functional evidence is important. Functional evidence explains how autism affects everyday life beyond the diagnostic label. Shows whether personal care tasks can be completed independently. Describes communication and decision-making support needs. Explains sensory, safety, and routine-related difficulties. Identifies prompting, supervision, or physical assistance records. How often support is required. Distinguishes true independence from tasks completed with intensive help. Supports both access and future planning decisions. What makes an Autism Level 3 report strong? A strong report links the participant's impairment, support needs, risks, and expected outcomes. Identify the functional difficulty clearly. Explain the type of assistance required. State how often and how long support is needed. Describe risks without the recommended support. Name the relevant service. professional, or equipment. Connect recommendations to participant goals. Ensure reports from different professionals are consistent. Use specific everyday examples to show what the participant cannot do independently, the support required, how often it is needed, and the risks without it. Autism Level 3, NDIS application time. NDIS processing times vary depending on the quality and completeness of the application. The NDIA may decide access or request more information. Missing reports can delay the process. Vague evidence may require clarification. Conflicting professional recommendations can cause delays. Complex health or home and living needs may take longer. Complete evidence should be submitted early. Respond quickly if further information is requested. NDIS Level 3, Autism Funding Amount. There is no fixed NDIS Level 3 autism funding amount for every participant. Funding is based on individual functional needs. Personal care and support worker hours affect budgets. Therapy and behaviour support may be considered. Communication technology can influence plan costs. Overnight support and SIL may increase funding. Informal support and living arrangements are considered. Online figures should never be treated as guaranteed amounts. Recent NDIS reports about funding amounts. Recent NDIS reports provide scheme-wide averages, not a standard Autism Level 3 funding amount. Average payments include many disability types. Median payments are often lower than average payments. A small group receives high-cost support packages. SIL and 24-hour support can increase plan spending. Therapy-only plans may be much lower. Scheme-wide statistics cannot predict one person's budget. Individual evidence remains the most important factor. How is Autism Level 3 NDIS funding decided? The NDIA considers whether each requested support is reasonable, necessary, and related to disability. Supports should help the participant pursue their goals. Funding must relate directly to disability needs. Supports should be effective and beneficial. Value for money is considered. Mainstream services must remain responsible for their role. Informal and community supports are also considered. Evidence should justify the type and frequency of support. NDIS Autism Level 3, Therapy funding. Therapy may be included when it addresses disability-related needs and supports clear participant goals. Occupational therapy may support self-care and sensory regulation. Speech pathology may assist communication and AAC, positive behaviour. Support may address behaviours of concern. Psychology may support emotional regulation, and coping recommendations should include frequency and expected outcomes. Progress should be measurable. A diagnosis alone does not guarantee therapy funding. Autism Level 3, NDIS funding for children. Funding for children may focus on development, communication, personal care, and participation. Speech pathology may support communication. Occupational therapy may address sensory and daily living needs. Positive behaviour. Support may develop safer strategies. Communication technology may improve choice and expression. Evidence should distinguish disability support from ordinary parental care. Children may require additional supervision, personal care assistance, or transition support. Autism Level 3, NDIS funding for adults. Adult funding may support daily life, communication, relationships, and greater independence. Assistance with personal care and meals. Support with communication and decision-making. Community participation and appointments. Behaviour and emotional regulation support. Employment, volunteering or meaningful activity goals. Independent living skill development, overnight care, or home and living supports. Plans should recognise privacy, choice, and personal preferences. Supported independent living for Autism Level 3. Supported independent living may suit adults who require substantial assistance at home throughout the week. SIL may include personal care and meal preparation. Support can cover routines and household tasks. Behaviour support strategies may be implemented. Sleepover or active overnight support may be included. SIL funds, support workers, not rent or groceries. Approval depends on functional evidence. Lower intensity alternatives must also be considered. Preparing for an NDIS planning meeting. Good preparation helps the NDIA understand the participants' real support needs. Bring current diagnostic and functional reports, include therapy and behaviour support recommendations. Describe a typical week, explain personal care and communication needs. Provide daily support records. Include overnight support information. Describe what family members currently provide. Prepare clear goals and examples of risks without support. Common Autism Level 3 NDIS application mistakes. Applications are weaker when evidence is vague, inconsistent, or focused only on diagnosis. Do not rely only on the Autism Level 3 label. Avoid requesting a standard funding package. Replace broad statements with specific examples. Check that professional reports are consistent. Explain the role and sustainability of family support. Separate NDIS supports from health and education responsibilities. Show how recommended supports may build skills or reduce risk. What happens? After the application is submitted, the NDIA reviews the access request and supporting evidence before making a decision. Access may be approved. The NDIA may request additional evidence. Clarification may be needed from treating professionals. An updated functional assessment may be requested. Approved applicants move into plan development. Unsuccessful applicants receive information about review options. Getting help with an application. A strong application should clearly explain the participant's daily support needs and functional impact. Keep reports consistent, include specific recommendations, and document how often support is required. Contact Effective Care for multidisciplinary autism and NDIS support.